Hi, I'm Dr. Steve Perlstein, and this is Second Opinion. Today we're going to talk about sore muscles from exercise and how to treat them. And quite frankly, we're talking about muscles that become sore from any type of physical activity, but the request for this video comes from my patients who exercise and have a lot of questions about what sore muscles mean. So this is for them, this is for you, and I hope that everybody learns something about sore muscles and what they mean. So let's take a look at what are sore muscles. Well, sore muscles are characterized by mild to moderate discomfort or pain, depending upon your interpretation, when a muscle is touched or pressured, squeezed, and when it's moved. So we all kind of know what soreness feels like, and there are degrees of soreness, but soreness is soreness, and the big question on everybody's mind is, have I been injured? Or is it not an injury? Well, the answer to that is yes, you have been injured. And the characteristic injury that it is micro trauma to the muscle fibers. So let's take a look at muscle fibers. Let's take a look at a picture of a muscle over here. And this is a picture of a bicep. The muscle's been cut in half. And you can see that there are bundles, many bundles of some muscle tissue in there. A muscle bundle is a bundle of muscle fibers. So that's the bottom line. We're talking about muscle fibers, long, fibrous muscle tissue, and that's what gets injured. It actually gets torn. Not all of it, but some of it, depending upon the severity of the injury. So yes, there's been an injury. And the thing to know, injury, we have this relationship with the word injury, and we think injury is only an injury when it's a big deal. But injury has to do with a disruption in normal functioning of a tissue, a group of cells. And it can be very, very mild and benign and not have a whole lot of consequences. But technically speaking, it is an injury, and it's very important to understand that because that helps you learn about it and how to treat it. Very important, has consequences for later on. So sort of getting ahead of myself, I want to get back to microtrauma, helping you understand what microtrauma is. And there is something that it means, and it means that there is, when you have soreness, that there is an adaptation process going on, usually seen in doing a new exercise or starting a new routine. And there's an adaptation that actually allows muscles to get stronger. So this is a good thing. It's not going to, though, and this is a myth that is being debunked. It doesn't mean that you are building and growing muscle. You certainly can build and grow muscle, but if you have soreness, that's not what it means. It doesn't mean that you're building muscle. It means that you are adapting to it and you're strengthening the muscle. So that's really important to understand. Now, there's another myth, and that is that there's a lactic acid buildup in muscles, and that's why you have the pain. So that's the myth, that you have the pain because of a buildup of lactic acid. Guess what? It's not true. Lactic acid is a normal byproduct of muscle activity, and it rises and falls with muscle activity, and that happens rather quickly. So the burning sensation that you feel, or the pain, is not because of the burning pain from lactic acid. It's because of the microtrauma. Again, I'm emphasizing that you are injured. Okay, even if it's a little bit, you are injured. Now, there's certain types of soreness. There's a soreness with exercise that occurs during exercise. There's a soreness that occurs right afterwards. And then there's another kind, and it's very specific to the type of exercise you're doing. It's called delayed onset muscle soreness, DOMS. That is characterized by soreness that occurs a few days after the activity. And it is characterized by having done a certain type of exercise. And we'll get into that in a moment. I want to say that this is a puzzling type of thing because a lot of people come into my office and they say, I am so stiff and sore and I didn't do anything. I just woke up this morning and there it was. And when we get into the history, we find out that there might have been a change in activity, change in physical exercise, change in something that they did, which they did not think was any kind of disruptive activity or an injury. And it turns out that, yeah, indeed it was, because they have this delayed onset muscle soreness. And then when we really delve into it, we find out that they were doing the characteristic exercise that is signified by the result of DOMS, and that is a concentric exercise. Concentric exercises are exercises that lengthen muscles. So, for example, and this is where it's tricky. If you think of a bicep curl, you think of the curling of the arm up this way, and because you're contracting the bicep muscle, and you think less of what happens when you lengthen it. That's the concentric part of the exercise. That's the aftermath of the exercise. But you can overdo that and lengthen the exercise too much or too often and create soreness that occurs several days afterwards. So that's the confusing part. Now, the thing about all those types of sorenesses is that they should all dissipate within a few days. So yes, you've been injured, and it should dissipate within a few days. You're adapting, your muscles are getting stronger. This is all a good thing, but there has been micro trauma. You can recover from it if you treat it properly. Before we get into that, I want to also talk about another myth. And it has to do with stretching, and that's been in the news in the last year. Is stretching really all it's cracked up to be? Should you stretch before you do your specific exercise routine, or should you stretch and warm up before you do a particular physical activity? Well, the short answer is yes, but the long answer has to do with delayed onset muscle soreness and the understanding that if you do stretch and warm up, it's not going to prevent soreness from occurring, especially DOMS. And also, if you overstretch, you can create delayed onset muscle soreness, depending upon how you're stretching. So it's a little bit of a tricky business. No one's saying don't warm up, but watch what your expectations are. If you get sore, don't be upset, because that's just part of the process. So very important thing to understand, and that's debunking another myth. Also, there's another piece here. There's a genetic component. Genetically, there's a determination of how sensitive we are to pain and soreness and stiffness. So you could put two people and put them in the same circumstances and have them lift exactly the same thing. And of course, you really can't do that precisely, but it's their genetic makeup which may make the difference between if one person gets sore or how much one person gets sore, plus their history. So it's a little complicated, but that's a fact that I wanted to let you know about. So when we look at soreness, we've already established that there's three types. With exercise, when you're doing it, when you're right afterwards, and the delayed onset. Then there's the soreness, and maybe it really starts to move into pain, but it really depends on how somebody interprets it. The soreness that comes from, and pain that comes from a sharp pain, a sudden stab or a pull in your back, or maybe more of a toned down one, but it's a more severe injury, and that's one you may actually call an injury. There's so many subtle gradations of this, all interpretable. So there's that soreness, and there's soreness that lasts longer than 3 days too. Then there's the soreness that disables you. You can hardly move, especially like delayed onset soreness. You get up and you're just really sore, or even the day after, you're really, really sore, you can hardly move. What's going on there? Well, this is where it's kind of difficult. You may need the assistance of a physician like myself who can interpret, based on certain tests, the degree, severity of injury. And the good news is that you basically treat them all in the same way, at least initially. You use ice within the first 3 days of the discomfort. You can also use ibuprofen over the counter for reducing inflammation. You can also use something like Tylenol, which is a pain reliever, all over the counter. And you can also use homeopathic remedies that contain arnica in them, which is a great natural anti-inflammatory agent. So you can do all that. And if the pain persists beyond 3 days, you can use heat. So depending upon the severity of the injury, if it's really benign, that may be sufficient. And if it continues more than 3 days, that'll tell you that's been a more severe injury. The other part to it is if it is more severe, such as difficulty moving, lasting for more than a few days, that's when you get the advice of a physician. And they can determine if your joints are involved, because all these soft tissues are attached to joints, and the joints might have been compromised in what caused the strain and the soreness, because these are strain and sprain injuries, and they do produce the soreness. So you may need some professional help on that. Should you continue to exercise? This again is interpretable. If you have a really benign situation, even if it's, and I said it's going to take a few days, so you want to know, should I stop exercising? You have to intuitively sense what your body is saying. One thing I've learned, the body does not know how to lie, so listen to it and really err on the side of caution. If you just have to exercise, then really seriously tone down your routine and maybe switch up your exercise so that you're doing some low impact aerobics or doing some good stretches, as long as they feel good and they don't aggravate anything. You're going to have to make the judgment on that, or have a health professional help you. So I hope that you have learned a lot. We've presented a lot of good information here, and I would love to get your feedback. All the contact information and where to find me on YouTube so you can subscribe to it and like my Facebook page. It'll all be after this video. I would love to get your comments, your feedback. What do you think of the presentation, and what do you think of the topic, and are there topics that you would like me to talk about? Does something come to mind? Because more than likely I'll do it. I've done a bunch. I've got a lot more to go. I'm going to constantly be putting out these videos. Second Opinion is a video series on topics like fitness and wellness and chiropractic and health and exercise. So if you're thinking of something that I haven't done already, please let me know. I more than likely will do it. So again, I hope that this has been educational, informative. You learned something, you feel better about what soreness is. And please watch more of my videos. They're all like this. So again, I'm Dr. Steve Perlstein, and this is Second Opinion.